I'm Mary, an oncology nurse.
And I'm Kristen, an oncology nurse practitioner. Akynzeo is a fixed-dose combination medication used for the prevention of acute and delayed chemotherapy-induced nausea and vomiting. The ready-to-use vial is the same medication as the previously available to-be-diluted vial, but comes with an IV strap attached to the bottle and may be infused directly from the bottle through an IV line over 30 minutes.
There are some unique considerations with the ready-to-use Akynzeo vial. Today we will share some information and tips for successful administration of this antiemetic premedication.
The Akynzeo ready-to-infuse vial can be stored in an automated dispensing cabinet, which provides ease of access by infusion nurses.
When gathering your infusion equipment, it's important to know that Akynzeo can run either on a primary line with a normal saline or D5W flush or as a piggyback. With either setup, it is very important to use a vented macro drip IV administration set to allow the product to infuse properly.
One challenge with smaller vials like Akynzeo can be priming the line without introducing air bubbles due to the small volume. This can be mitigated by using vented tubing and only inserting the spike to the neck of the bottle so the spike remains covered by the liquid.
I'll demonstrate some key considerations when infusing Akynzeo through a primary line. Before spiking the vial, close the clamp on the IV set and make sure the vent remains closed for now. Following sterile technique, hold the vial in an upright position with a stopper up. Insert the spike only to the neck of the vial to allow all of the Akynzeo to flow into the line. Keeping the spike tip at this level allows the full volume of the medication to infuse without introducing air into the line. Once you are comfortable that the spike is secure, you may proceed with the next steps. Using the strap attached to the bottom of the vial, hang the inverted vial onto the IV pole and squeeze the drip chamber until it is half full with Akynzeo. Now open the vent. Your tubing is now ready to prime.
When using an IV pump, it's essential that the full dose of Akynzeo is administered without introducing bubbles into the system. Attach Akynzeo to the primary line using normal saline or D5W as the secondary line. Ensure the pump is set to deliver the entire dose over 30 minutes.
That's right, Kristen. We want to make sure that the dose of Akynzeo is administered over 30 minutes by setting the pump's infusion rate according to protocol. When programming the volume to be infused, consider the volume of Akynzeo that is remaining in the vial after priming the tubing. During the infusion, if the product does not appear to drip correctly, check that the vent is open and that the tip of the spike is at the level of the neck of the vial within the liquid.
Once the vial is empty, you may see foam bubbles have formed in the vial. This is normal and does not affect the amount of medication delivered to the patient. After the infusion is complete, follow your institution's low-volume flush protocol, or you may flush at the same rate with the normal saline or secondary set.
Thank you for following along as we reviewed some of the key considerations that are important when using the Akynzeo ready-to-infuse vial. To summarize, make sure you are using vented macro drip IV tubing where the vent is opened after you fill the drip chamber. And have a flush ready to ensure that the full dose of medication is administered per your institution's policy.